appliance therapy. Oral appliance therapy provides an alternative treatment option for those with upper airway resistance syndrome and obstructive sleep apnea, also known as OSA. The patient's treatment journey begins with the referring physician, who will have administered a sleep test and, either due to the patient's noncompliance with CPAP or the patient's preference, sends the patient to a dental sleep medicine practitioner for an oral appliance. The dentist's job in properly treating a sleep apnea patient with an oral appliance involves a set of processes that are undertaken with the goal of identifying the patient's specific needs, the condition of his or her mouth and throat, and their systemic health. Once the patient has been evaluated, the appropriate device can be selected and fitted, allowing the patient to begin their treatment and follow-up. I'm Sri Roy, and you're listening to Sleep Review, the trade media outlet for the sleep medicine subspecialty. This podcast is inspired by the growing awareness of the importance of sleep to overall health. We invite all healthcare professionals, from primary care physicians to sleep specialists to dentists and others, to tune in and learn about clinically based best practices that will help your patients sleep better. Sleep Review does not endorse any products or services, including those that advertise with us. We strive to report clinical information that you can apply to your practice today. This episode is brought to you by the MedCore platform. Learn more at medcore.com/our platform and stay tuned for more information during the break. Outlined in this week's episode is the standard process used in the office of Jeff Rogers, DMD, DABDSM, to guide the patient from initial consultation to successful treatment. Jeff Rogers has been in private practice for over 20 years, specializing in both general dentistry, primarily restorative implant and cosmetic dentistry, and dental sleep medicine. A diplomate of the American Board of Dental Sleep Medicine, Rogers is a board-certified expert in sleep, treating patients who suffer from sleep-breathing disorders at his practice in Dunwoody, Georgia. While each dentist runs his or her office slightly differently, this patient journey is usually followed with the goal of selecting the appropriate appliance and treating the patient's OSA long-term. You can get the print article this podcast is based on at www.sleepreviewmag.com and search for the headline, The Oral Sleep Appliance Patient Treatment Journey. The direct URL is www.sleepreviewmag.com/oral sleep appliance patient treatment with a hyphen between each word. Step number 1, the initial appointment. At the initial appointment, the sleep study is reviewed to confirm the patient's suitability for oral appliance therapy. Disqualifiers for oral appliances include physical conditions that would make it extremely uncomfortable for the patient to wear an appliance, such as acute TMJ or gum or dental issues that would prohibit the device's adherence to the teeth or dental implants. Jeff Rogers also has patients fill out a CPAP intolerance form at the initial appointment. The CPAP intolerance form gathers detailed information about the patient's reason for intolerance to CPAP and their decision to turn to an oral appliance for sleep apnea treatment. Patients may check boxes that include an inability to get the mask to fit properly, claustrophobia, and disturbed interrupted sleep caused by the presence of the device. Step number 2, the records appointment. If the patient is ready to move forward with treatment during the initial appointment, a digital scan or standard impression is administered by a sleep assistant. Alternatively, these records may be taken during a secondary appointment if the patient indicates during the initial consultation that she or he would like to think about the options, doesn't have time to have records taken during the initial appointment, or wants to discuss their options with a partner. Additionally, records may be taken at a secondary appointment if the patient has yet to be diagnosed with OSA or has not received treatment for a significant length of time and needs to be retested. The purpose of taking scans and impressions is twofold: to thoroughly scan the teeth to provide a full picture of the mouth, soft tissue, and throat, and to gather information that will help properly fit the appliance. The decision to use either a digital scan or standard impression will largely depend on the patient as well as the dental sleep medicine practitioner's preference, though there are some qualifying conditions that may dictate one method over another. If the patient is prone to gagging, for example, a digital scan will reduce discomfort and be easier to complete. If the patient has a small mouth, impressions are recommended as the scanner on many existing cameras is too large for small mouths. After the impressions are gathered, a bite record is taken. In Jeff Rogers' office, the preferred method of gathering a bite is a George gauge. George gauge bites are taken with a 2mm, 3mm, or 5mm fork, depending on how much the bite should be opened. Step number 3, selecting an oral appliance. With records taken, an informed decision can be made about which appliance will most appropriately treat the patient. This decision is based on several factors, including the patient's body mass index or BMI, apnea-hypopnea index or AHI, range of motion, gender, and medical history. In most cases, appliance selection is straightforward. Some examples of special appliance selection cases include an edentulous patient who would benefit from a tongue-retaining device, or a patient with material sensitivities who may benefit from a device with no metal, or patients who are pilots or commercial drivers who would benefit from an appliance with an objective compliance tracking chip. Once a decision about the appropriate appliance is made, the information is sent to the lab where the appliance is developed. Next, we'll share the last 2 steps in the oral appliance patient journey. But first, a thank you to our sponsor, the Medcore platform. Medcore's mantra is not only to innovate within our company, but to provide a data platform for sleep medicine stakeholders to drive innovation within their own businesses. Gain access to hundreds of core data sources, including medical journals, blogs, social media conversations, advertising, emails, and articles. Start leveraging device market insights across your enterprise to make informed decisions at every level today. Sign up for a free demo at medcore.com/our-platform and fill out the form at the bottom to schedule a Medcore demo today. That's medqor.com/our-platform. Okay, now here's the next step. Step number 4, fitting and delivery. Assuming the records appointment was accurate, the fitting appointment should go fairly smoothly. Once the model is returned from the lab, bite position is checked against the position provided to ensure they are a match. If not matched, generally the appliance has to be remade to ensure accuracy. At Jeff Rogers' practice, the office also checks that the appliance has the maximum amount of retention the patient can tolerate. While a good amount of generalized retention is important, also important is the absence of localized pressure areas. If pressure spots are not relieved, orthodontic movement can occur, which all good dental sleep medicine practitioners try to avoid. Adjustments are made accordingly during this appointment to maximize patient comfort while maintaining good clinical retention. At delivery, most offices also provide each patient with information about home care for the device and morning jaw exercises, which help maximize comfort and may reduce the chance of bite change over time. A few examples of exercises Rogers' office encourages patients to do are the thinker position, in which the patient rests their elbow on a table or countertop and places their chin in their palm, letting the weight of their head rest on their hand, and then opens and closes their mouth. The patient alternates this movement with a side-to-side movement of the jaw. The AM aligner, in which the patient takes the AM aligner provided to them at delivery and holds one end in their hand, biting slowly until the jaw feels normal. The chewing gum, in which the patient takes a pack of sugarless, soft gum with them in the shower. The hot water of the shower helps relax the muscles, and the chewing helps return the jaw to a normal position. During delivery, staff also shows the patient how to adjust their appliance and provides them with an oral appliance calibration chart, which allows the patient to track how many turns to the right, left, and center are issued each night. In the interest of total health, Jeff Rogers' team also educates the patient about good sleep hygiene, such as keeping consistent bed and wake times, maintaining a cool sleep environment, and reducing caffeine consumption. Step number 5, follow-up. Finally, regular check-in is conducted to ensure the patient is comfortable and receiving appropriate treatment. In Dr. Rogers' office, beginning with their 1-week follow-up, at each appointment, the patient completes the Epworth Sleepiness Scale to measure daytime sleepiness, and the appliance is adjusted as needed for patient comfort. Jeff Rogers' follow-up timeline is as follows: phone check-in, 2 to 3 days post-delivery, 1-week follow-up, 1-month follow-up, 3-month follow-up, 6-month follow-up, usually only for severe cases, and annual follow-up. All improvement reported is forwarded to the patient's referring physician. At this point in the patient's treatment journey, all that's left is continual follow-up to ensure treatment is successful, the appliance is working as it should, and the patient is enjoying restored sleep. The biggest takeaway is there are several steps involved from start to finish to ensure a well-fitting and therapeutic oral appliance for patients who fail or cannot tolerate CPAP. The dentist takes the lead on these steps, but should coordinate with the sleep physician every step of the way. The basic 5 steps are initial appointment, impression and bite records appointment, oral appliance selection, fitting and delivery, and follow-up. You've been listening to Sleep Review. I'm Sri Roy, editor. Visit www.sleepreview.mag.com/oral-sleep-appliance-patient-treatment to read a print version of this article and access any cited studies. Remember to visit sponsor www.medcore.com/our-platform for a free demo. Tune in next week for more clinically based best practices that will help your patients sleep better.